Okay, I think in the interest of time, we've only got a short session today, so we will get going. And I think those beep beeps are slowing down, aren't they? Most people, I think, have arrived. So again, welcome for those who've just joined to this session. On behalf of the Specialist Centre for Public Health and the Specialist Centre for Social Care, we're delivering this webinar on applying for an NIHR Predoctoral Award. And really what we're hoping to do is sort of demystify the process and very much give the message that you can come and talk to us at the Specialist Centres for Public Health and Social Care, and we can help you with your award. So joining us today on the call, I should have introduced myself. I now realise I'm Louise Hayes and I am based in the Specialist Centre for Public Health, and my colleague Laura Tucker from the Specialist Centre for Social Care is also on the call, and she'll be doing some of the presenting as well. We also have a current, or past rather, completed a predoctoral award, Alex Ryan, who will also be speaking about experiences of having an award. And also on the call, we have two representatives from the NIHR Academy who will stay online for the Q&A at the end. So they'll be able to help out with any questions you have about the award. So that's Richard Furnable and Richard Millen from the Academy. So thank you to both of them for being here as well. Okay, sorry, I'm talking a lot, having said we've got a short session, but we will try to keep it to just about half an hour so that we've got a good 15 minutes for some questions at the end. So without further ado, let me get going. I'm going to start by just saying a little bit about the awards that NIHR offer. It's all information that you can easily see on the website. So I'll go through that quite quickly and a little bit about the process of applying and why you might want to apply. And then I'll hand over to Laura, who's going to talk a bit about preparing your application and some pointers, things to think about. Then we'll go to Alex, who'll talk about their experience of holding a predoctoral award, and then just wrap up with some sort of final contacts and then get to the Q&A. I've got Scott Lloyd here helping out as well, who's also held one of these awards and will be happy to take questions as well. And also he's going to help me manage the chat. So if you've got questions as we go, do put them in the chat and we'll try and answer them as we go along and then pick up any we don't get at the end. Okay. So, now I'm discovering I can't move my slides on, so let me try that again. Okay, so just to run quickly through the awards that are available. So the predoctoral award, which we're here to talk about today in a bit more detail, and then there's a doctoral award and then the postdoctoral award. So very briefly, what they each cover is for the predoctoral, this is support for you to study at sort of master's level and develop an application to do a PhD. There's only one opportunity to apply for these each year, so that usually opens in January and will close in March. They are the equivalent of 12 months work time, so it might be 2 years at 6 months or 12 months full-time or some other combination, and you get during that time 20% of your time for your practice. So if you're a practitioner, you have that practice time available. The doctoral award, as you might expect, is to allow you to complete a PhD. So there are two opportunities for that each year, and these are longer awards, so 3 years full-time equivalent. And again, you would have 20% of time for practice. That one's open at the moment with a deadline of 15th of January. And the final one, the postdoc, again, that's 2 opportunities per year. As the name says, that's for postdoctoral, so once you've completed your PhD. Again, longer, so these can be 2 but up to 5 years of full-time equivalent funded time, and you get 40% of your time for practice on the postdoctoral award. That one's also currently open, but the deadline for that very, very soon upon us. And I just wanted to emphasise really, some of you will be aware that the NIHR changed their personal awards or fellowship system last year, and there's no longer a sort of specific stream for people applying from local authorities, which there was previously, but that's not to indicate that you're not very, very welcome to apply. They are positively encouraging applications from local authorities, and so there is a specific panel that I just wanted to draw attention to. So although everyone will apply through the same process, it's just one application form. Once the applications are received, they are separated out and triaged out to the most appropriate panel. So there is a specific local authority, social care and public health committee. In addition to those, the main awards offered by the Academy, I just wanted to very quickly draw your attention to these awards. So the Public Health Grassroots Awards is one that we are running through the Specialist Centre for Public Health. It's open at the minute, just opened yesterday, and there's a webinar on the tomorrow, which there's a link on the slide there, which we will circulate the slides later. So all these links will be available. Closing date, that's the 27th of January. You might also be aware of the LA Sparks, which are an opportunity for local authority staff and people working in NIHR infrastructure to sort of cross-fertilise, so to work in each other's organisation for a short period of time to get some experience of that. And if you're planning to apply to any of the main Academy Awards, you can also apply for the Pre-Application Support Fund, which is a sort of lighter touch application to get some funding to free up your time to develop your Career Development Award application. Excuse me, I have a very quick drink of water. Okay. I'll just talk very quickly about the process for applying for your pre-doc award. So if you're going to do this, the sort of overriding message is come and talk to us at the Specialist Centre for Public Health or the Specialist Centre for Social Care, and we can help you with all of this. But essentially what you do is register on the NIHR Awards management systems and navigate to the Predoctoral Award when it's open. It won't be there at the moment because it won't open until January. And then you develop your application, and this involves submitting a one-page of your research area of interest, a 3-page narrative CV, 3 pages on your career development plan, a Gantt chart, and then letters of support from people who will be involved in supporting you with your pre-doctoral award. And the key dates, these are the dates from 2025. They've not been released yet for 26, although Academy colleagues on the call might know when they are, but we suspect they'll be similar to these. So last year it opened, or earlier this year, opened end of January the 29th with a deadline of the 20th of March, and then funding decisions were made over the summer, so between June and August, with start dates from September this year to March of next. So we anticipate that will be a similar timescale for next year. And just to reiterate, do come and talk to us at the specialist centres if you're thinking of applying. So the last thing from me before I hand over to Laura is to think, why might you want to apply for one of these career development awards? And so we all, I'm sure you're all familiar with this Dahlgren and Whitehead rainbow, which demonstrates how all the different things that impact on health, and these are all things that local government tend to be involved in and make decisions that have an impact on. So those decisions should be should be grounded in research and evidence from research. And I asked Helen Walters, who's a public health consultant to the NIHR Public Health Research Programme, why it's important for local authority people to be involved in research. And this was her response, that, you know, it's very well established in the NHS and no one will question and the NHS involvement in clinical research. So likewise, nobody should be questioning local government's involvement in wider determinants of health research. And so these personal awards offer you that opportunity to do just that, so to get involved in research that can have an impact and influence decisions that really impact on people's lives. Okay, I'm now going to hand over to Laura to talk you through the some how you might go about developing your research applications. Actually, just before I do that, Laura, I can see Richard Millam has raised his hand. Would you like to come in, Richard, at that point?
Yeah, sorry, I'm not trying to derail the conversation. So just to chime in, you're right, say we anticipate similar competition timeline to the one we've done this year. It may be slightly earlier. So just a recommendation that as we get into the new year, do keep an eye on the NIHR website for details. And just a top tip in terms of the system that you've mentioned there. This is somewhat time sensitive top tip. So the system, you can log in and register now, so I'd recommend people do that. But also there's currently open competition for the Senior Clinical and Practitioner Research Award that uses essentially the same application form. So you could sort of create a dummy application form in the system for that and download things like the templates that you'd need to complete and have a look at the form, what it looks like. So that's just a bit of a tip to do now. But thank you. I'll stop talking.
Thank you very much, Richard. That is a top tip, and these things are time sensitive, and it's good to reinforce. We would say come to us early as well, and also we will circulate in our newsletters and so on, and put out on our LinkedIn when these competitions go live. So as well as keeping an eye on the website, we'll try and keep you informed. Thank you. Okay, Laura, over to you, and I'll do the next slide, please, Bit.
Thanks, Louise. And I guess since we're on top tips, that's really what my bit of the presentation is about. It's not specifically what to include in your application because that's going to be very personal to you, but it's the things to think about while you're developing it. So the first thing, my first top tip, my first piece of guidance is to say, go onto the NIHR website and read the guidelines, and then read them again, and then ask for help on any bits that you don't understand. There's a lot of information on that website, and you want to make sure that you're really clear on what is on there, what it's asking you to do, what you're being asked to demonstrate in your application, because what you want your application to stand out from the rest of the crowd. You want to be one that people look at and go, ooh, and you're not going to be that if you haven't made sure that you've hit everything that the application is asking for. So really make sure you're confident about what's being asked of you. Make sure that you're very clear on all the pieces of the application sort of jigsaw puzzle, because these are personal awards. They're about you as much as they are about your topic. So think about me. Why am I in this here? How do I fit with this project? How does this project fit with me? How does all the pieces come together to make something really strong that we can see how it has a pathway forward? Thinking about that, think about who the right team to support you are. Actually, have you found yourself useful supervisors? Can you demonstrate why they're useful supervisors? Do they know your area of research interest? What opportunities can they give you? If all they're going to do is sit there and be your supervisor as a sort of tick box on paper, that's the wrong kind of supervisor. And I'm going to talk a bit more about supervisors on one of the later slides, so I'll leave that one there, but just start thinking about that. Why have I picked this person? How are they going to help me get through this process? Get all the advice and criticism you can while you're preparing your application. Share early drafts of it with people. Share them with experts, share them with academic experts, with practice experts, with lived experience experts, with people who aren't experts. Get as much feedback from as many places as you can and be thick-skinned about it. Because you don't need these people to tell you that you're great, even if you are great. I'm sure you're all great. You need people who will make you better. So you need people who will read through your application and be critical. So reach out to those people and ask them to do that. Be prepared to take that criticism and build a better application from it. Louise, do you want next slide, please, Louise? Think also about your research interest. This is a predoctoral award. You're not being asked to develop a full research proposal, but you do have to talk about your area of research interest. You need to think about why this research interest is relevant and why you're the right person to do it. So where has it come from? Why are you bringing this up as a research interest? Why is it important? Why should local authorities care about it? Why should the NIHR care about it? It's got to go beyond your personal interest in the topic to demonstrate why we should all be interested in the topic. And in terms of thinking about yourself in that process, you need to go beyond being interested. It's not enough to say, I am interested in research. Show us how you've engaged with research, show how you've used research in your practice, show what sort of research connections or activities have you been taking part in. Tell the funding panel why they should invest in you to carry on this work. And bear in mind your local authority practitioners. You're not expected to be involved in research in the same way as an academic applicant would be, but you are expected to be involved in research that would make sense in the context of social care or public health practice. Also think forward. You want to think about research, something that has roots, something that's worth following up, something that can evolve and develop forward. The hints in the name of these awards, these are predoctoral awards. The idea is that you're going to build towards a doctoral application. So think about that. Demonstrate how what you're going to do in this pre-doc might lead into a doctoral award and where you think it might go. And remember, you've got the 80-20 rule. Fellowships are 100% funded, but 20% of your time should be spent on practice activity and keeping in contact with practice, associated training. So think about how you want to build that 20% into your award as you go through the year. Next slide, please, Louise. Thank you. So thinking then about your training and development plan, you want to make sure that you are reflecting on you, your current skills, your knowledge, your experience, your qualifications. But don't feel like you have to invent this from scratch. Use the resources that are there for you. The Vita Research Development Framework is jointly developed by researchers and practitioners to highlight where those key competencies are. So use it. Use it as a framework to say, you know, where are my strengths here? Where are my areas for development within this framework? How can I turn that into a plan? Make sure that your training program is justified. Ask yourself, do I need a research master's degree? Do I need a master's degree? Or is it specific training, specific skills development, specific activities that I need to do? Don't default to the master's if you already have relevant skills that will make that not the most appropriate for you. Think about ethics, think about inclusive research, think about public involvement, all the kind of areas where you might need skills and training development. Think also about networking opportunities, collaborations, placements. Do you need to build a collaboration of people who can support you to prepare for a doctoral fellowship? What activities need to happen in your postdoc award to make that happen? Do you need to build your network to develop your academic profile for the same reason? If you're thinking about conferences, again, go beyond, I'm going to go to conferences to present my research. Think about which conferences you would want to go to. Why would you want to go there? Why is it good to present the work you're doing there? What kind of networks can you build in that space that will inform your future work? Really kind of go into that sort of depth. And think about whether actually, we're going to talk about supervisors in a minute, but along with your supervisory team, so your primary academic supervisor and your mentor, are there any other specialists who might be useful to be involved, who would be willing to be a mentor, who can bring you through? If you're thinking about practitioner research, is there someone on your supervisory team who understands the challenges of bringing research and practice together? Yeah, have they got that relevant experience? Have they got that background and knowledge that they can help guide you with that? Next slide, please, Louise. And around that mentors and supervisors, it is so, I've said this about 3 times now, I'm going to reiterate it again. It's really important to have the right people around you. You need to find people who are credible. You need people who have capacity and who are committed to your project. So ask yourself, the people I'm talking to, do they have the right knowledge, experience and skills? Actually, do I get on with them? Do we work well together? Having met them and chatted to them, make sure you've met them and chatted to them. Are we going to work well together over the course of this project and thinking forward to a future PhD? Actually, are they in the position where they are showing that they're engaged and they're committed? They respond to my emails, they give useful feedback. They don't just tell me I'm great. Am I getting something beneficial out of this potential relationship? And are they talking about things in a way that makes sense in terms of practice research? Make sure you're really clear on the ask when you're reaching out to supervisors. What sort of time commitments, what role do you want them to play in your project so that they can give you an honest answer about whether they have capacity to do it? And think also about how will you stay in contact? How will you manage? How will you get the most from your supervisory team as you go through your award, and make sure that's clear in your application? I think that covers all of my top tips. So moving forward, so I'm going to hand over to this point. Let's go from my top tips to Alex's experience. Alex, do you want to come in and talk to us about your experience of a predoctoral award?
Yes, and thank you for hearing all your top tips. You guys are spot on. I'm gonna start just with my one top tip that I haven't heard yet. So I did a predoctoral in a local authority setting in children's services. Top tip, when you're applying, check out the rules in your local authority about doing research, publishing, ethics, and what permissions you need even around presenting at conferences, because most local authorities will have quite a few processes. I accidentally stepped into some things because we didn't know I was supposed to check with X to do something. So I would strongly urge that. So I did a predoctoral, I finished just over a year ago. I'm well into my career. I work in frontline children's services and social care, and I work in a specialist area called family group conferencing, family group decision making. And I honestly, it took a lot of courage to apply, because being in frontline practice for as long as I was, I thought of academics as those smart people somewhere else. So it was a brave thing to apply. I thought the application process was extensive, but really, really helpful to get you ready and thinking about everything you need. I think the other thing I would suggest is in doing my application, I consulted with probably around 30 different people and quite a few family members with lived experience. And they really helped critically shape some of my thinking and development of my application, and being able to say in it, this has already been led by family voice and family experience. And it felt like a really nice way to start. I personally found it surprisingly wonderful on every level. It was really challenging to like go back to academia, and especially beginning that discomfort I felt of thinking of myself as a practitioner academic. It felt like I was, those are fancy smart people somewhere else. But over the course of the year, I got more and more comfortable, and now feel really comfortable and happy in that space. And I did a master's in social research at the University of Sheffield. It was excellent. My academic supervisor couldn't have been any better, just amazing. And I would say not only am I a better practitioner, I'm just a better person from the whole experience. So if we could let every practitioner have a year or more to get to do something like this, because what it did for me is it refreshed me, and I got to bring all this new information that otherwise in the busyness of frontline social care, you just don't have the time. Whereas now I carve out the time, and I run my whole life differently. I carve out time in my diary now that's research and evidence, because it has to stay a priority in my practice. And that was a gift from this whole process. So I would just say, go for it, give it a shot. And all the tips they've given you here, I would really say, give yourself enough time. It is a big process. And use that RSS. They're brilliant. They will give you really good feedback, but you got to give them enough time for you to have enough time to take it all back. But I found all of it. I really am like the poster child for what an amazing experience it is. And I've even said to the folks here, anybody who wants to contact me just to chat or run anything by, or, just as somebody who's been there, happy to. I want my personal email sent, not my work one, please. But anybody who wants to reach out for a little more than just because I need to keep this short and sharp. But I would just say, go for it. And don't be put off if you don't get it first try. That's part of the learning and part of the whole journey. So that thick skin, Laura, I agree. That's part of what I learned from all the brilliant academics that I was learning from, was like failure. I don't think it's failure. It's all kind of learning towards something, but it's part of the process, and it's good. It's not anything to be afraid of or ashamed of. Is that all right if is that enough?
That's brilliant, Alice.
Go, people. I'm cheering you on.
Thank you so much for a ringing endorsement for the Predoctoral Award Scheme. Thank you very much indeed, Alice. Really appreciate that. I'm just going to try and share again, but I might need a minute. Even 5 years post-COVID or whatever, we are still a struggle. The one, I think. Are you seeing my slides? Yes, on the right slide, maybe. I'm seeing a completely different. So every time I share it looks different. That's right. Brilliant. Thank you so much. Okay, so just to wrap up from our point of view, and then over to you for questions. And as I say, we've got Richard Furnivall and Richard Miller from the Academy who can help with questions as well. So get those questions ready if they haven't already been answered in the chat. So I just thought, I think, Laura, you noted there's an awful lot of information on the NIHR website, which we do recommend you read. And I've just tried to highlight some of the bits that might be most useful. And on these boxes all link to the relevant bit on the website when you get the slides. I'll just talk you through them, although obviously you can read them yourself. But there's the award overview, so an overview of what the Predoctoral Award offers. There's the assessment criteria, so always useful to have that in mind as you're drafting your applications. There's guidance on completing the application form. What we haven't talked about today, but we do have a session on next week, is your public involvement or working with people and communities, and also research inclusion, which are really important aspects of any application to the NIHR. There's a link at the bottom there to the awards management system, which, as Richard's already indicated, you could get on now and get registered, and that's one of those jobs that takes more time than you might anticipate, so good to get that ticked off. And also I've put the link to the chair's report from the previous round of these awards, because that can be really helpful. There's a reflection from the panel chair on the things that they saw that they liked, and the things that came up that they didn't like so much, or whether they didn't think things had gone so well. So that can also be really useful. But just really to finish, I was hoping to have a grand flourish, but my button didn't work. But do come to the RSS Specialist Centre for Social Care and Specialist Centre for Public Health. I think you've been bombarded with our links during this session, but there they are again. And just to say, our door is always open, and it's never too early to come. So do come if it's even just a slight thought that you might go for one of these awards. Do come to us to start talking about that as early as possible. Okay, so I think I'll leave it there, and I'm going to stop sharing again. Only figure out how I would do that. There we go. And we're open to any questions that you have. So is there anything in the chat which I'll just bring up? Just got shaking saying we've dealt with. Oh, okay. One question that hasn't. Okay, so a very specific one around eligibility. I think that might be best. I'm looking to Richard Furnivall and Millum to see whether this very specific eligibility question is probably best to come to you directly, is it, rather than in this forum where they...
Yes, I would suggest so, rather than go too deep into individual circumstances. Get in touch with us and we can explore that in a bit more detail. Just to kind of manage expectations a little bit, is quite tricky for us to confirm eligibility up front without a lot of context and detail. So we may only be able to go so far with it, and you may be best talking locally as well, alongside reaching out to us. But yeah, happy for you to drop us a message.
Right, thanks, Richard. And I can see a few hands up now, so I'll go through them in order. And apologies for pronunciations. Raman, I think you were first to put your hand up, and I hope I pronounced your name correct.
Is it Raman, did you say?
Yes.
Yeah. Hiya. Right. It's not the first time. Last year I tried to apply, but I think it was late. So I just decided just postpone, because I just learned about this, in January by the starting this. So I understand the process and the, commitment and the time, everything. You have to be really, really careful and just, have enough time. So what I understand after that, a lot of these things. First of all, I'm from the local authority and I'm practitioner social work. I understand there is big gap between public health and local authority. There is not as much support what it is from the NHS and from the public health. So I couldn't raise this. I couldn't, a lot of our management, they don't see value of this. And it's not, I think, although I have tried to convince them, but it's not easy for us, because all the time they say, which at the moment they might be right as well. So they see priority is the case management. We are already struggling sometimes with the case management, personal life, what's happening outside, this, that. But at the top of this, doing this, application is really, really hard. The other thing, what I find personally, when I started to get support from these NIHR staff, they were brilliant. They just put the time started. But some of the things they said, go and have a look this, go and have a look this, go and have a look this, which for the time being, I didn't have enough time. As an example, I said, this is a research I want to focus, but I cannot narrow it down. Can you just advise me what I'm going to find out, like PPI, what they were talking? They said, no, you're going to have a look. So that's fine. Anyway, the other problem what I had, I want to say, because what's happening now, it's just I twice, 3 times in different, it would be, I'm sure, going to be helpful for a lot of people here. They're going to apply. One of the things I find out, going through some of the things, it's expected from myself. As an example, a statement from the supervisor in the placement. First of all, they said they don't have enough experience in research, but they are willing to support. They said they don't know how to do this statement. And I approached different people. They said, can we have, I don't know, some
thanks, Ron.
practice, teaching or this, today
Yeah.
I was expecting some of the practical steps and showing us how to do that, at least give us some sample, this, that, so we can present to our supervisor, this, that.
Yeah,
so
thank you.
although it's a lot, but thank you.
Yeah, I appreciate what you're saying. I think you've raised some really important points, and we are aware that it's much sort of more well-trodden route within the NHS to apply for these type of awards, and that's why we're here. And NIHR have put money into the Specialist Centres for Public Health and Social Care to try and to support people to go through this process. And we're gathering people who have done it. So we've got Alex, I've got Scott here with me. They've navigated it, and they're very happy to talk to you about how they approached it. And we're not saying there are no barriers, and we are aware that they're there, but we're sort of early in the journey in terms of developing that research culture in local authorities, and there's definitely work to be done, but there is a commitment from NIHR to support, and that's what we're here for. And thank you for flagging that. And just, I know one of the things you raised was it does take a lot of time, and I think we've already gone over that quite a lot today, but that there is also the pre-application award fund, which is available through NIHR, which is specifically there to buy out time to allow you to develop your application for these fellowships or personal awards. So that is also a possibility, and we can have conversations about that. So thank you. I can see we have 2 other hands up at the moment. Is it Fazer? Is he there?
Hi. Yes, thank you.
Hi.
That was a lot to unpack, so I'm writing my notes. I just wanted to ask, I'm a senior social worker, sorry guys. I work in a London borough. In regards to, because I know there's a number of awards, there's a post, the pre, and the pre-training. Is there a number of awards available for each? Is there like a set of numbers?
As in a certain amount of money available at each, and I'll pass over to the academy on that. But I think in short, the award, your applications are judged on their merit, and if they're viewed as fundable, they then go up to DHSC to see how far the budget will stretch, I think, in essence.
Yeah, I can add to that. It's exactly right. Yeah, there's not so much a limit on numbers. It's just tied to the budget. So don't worry so much about numbers. Just do your best, and our selection committees will do well to make sure that the good applications get through. And then we do our bit with DHSC to try and get as much funding as we can. So
okay. Thank you so much.
Don't be put off by numbers.
Thank you. And Chloe, I think yours is the next hand.
Oh, hello. Yes. My original question was quite similar to Rahman, but I might slightly change it now, because I'm thinking in terms of kind of getting support at work. I'm in the NHS. I'm in forensics. I'm an art psychotherapist, but I was just wondering what else I can do to kind of get a bit of buy-in from my employer. And I'm just wondering, I'm just sort of floating the boat here, but maybe thinking about doing some workshops or some sort of, so I can kind of gain a bit of support. That, I mean, I'm working in a supportive environment, but I think that there are a lot of my kind of conversations, I've been told that I'm a clinician, not a researcher in terms of my employment. But I'm just wondering, in terms of an application, are you looking for candidates that have already have got something in publication? I don't, and I wondered if that doesn't, I don't know, in terms of kind of favourability from a candidate, does that look a bit, no?
No, I'm going to pitch in on this one, because I've had about 5 conversations with people who sit on panels about this.
Okay.
If you were applying as an academic from a university, then the panel that you would go to would probably be looking for you to be, involved in publications, involved in research in that activity. Maybe not having published at predoctoral level, but on that journey. As a practitioner, and going therefore to the practitioner focused panels, there isn't that same expectation at predoctoral that you're going to have published already. But what they want to see is that actually you are interested in research, you are trying to find ways to fit research into your practice, because they recognize exactly what you said, Chloe, that my employer views me as a practitioner, not as a researcher.
Yeah.
Research is not my job.
Yeah.
So it's about demonstrating that you have an interest and an investment in research within the context within which you work.
Mhm.
And therefore, what that looks like for a practitioner is likely to be different to what it looks like for an academic. But what I would also say in terms of that first question about selling it to your employer, which is similar to what Rahman said, we've got a webinar next week, and I can't remember what it's called. I think it's next Tuesday. But one of the things we're going to talk about is the logistics and employer buy-in. And I do not have magic solutions to this. It's a tough practice environment out there, but we can maybe help you start thinking about how to do that. And in terms of specific support around engaging with employers about getting practitioners into research thinking and how it can be useful for the local authority, for the NHS as well, please come and talk to me, because this is something I'm really interested in terms of the work that I'm doing around practitioner-led research. So hearing about the barriers would be really valuable. So if you're having those barriers, if you're running into those problems, please get in touch with me at the Specialist Centre for Social Care, so that we can talk about it, because then I can potentially start moving that forward on our side as well.
Lovely, I will. Thank you very much, Laura. Thank you.
Yes, thanks, Laura. I think that was a helpful answer. And I think important that we keep emphasising that if you're applying from a local authority, your application will sure to get to the local authority panel and not be judged against people who are working in more academic institutions where there will be more expectation around that research background. And I think I'd be right in saying that what the panel will look for is that you've demonstrated an interest in research, as you said, Laura, within the sort of constraints within which you're working. I don't know whether anybody else wants to comment on that. And we have got another session next week, which I've just put in the chat, which is a bit where we'll cover some of the things about sort of how you might negotiate with your employer, and also we're looking in that session at a lot to pack in, but also how you might think about public involvement and research inclusion in the context of submitting your application. Richard, you said something earlier about there being another application that is currently available on the awards management system that potentially people could use as a bit of a dummy. Could you just remind us what that one was, please?
Yes, of course. And just to be clear, don't use this as your application form. Just use this to get a view of what the application form will look like, because when the competition closes, you may not be able to access what you put in the form anymore. But so if you were to create an account in the new system now, get yourself registered, set up and logged in, when you go to search for open funding opportunities, the Senior Clinical and Practitioner Research Award, SCPRA, should be there for you at the moment. Now it closes on the 24th of November. So if you wanted to have a look at this, you need to do it in the next week or so. But the form is essentially the same form that will be used for Predoctoral Award. So if you have a look at that form, all the things that is going to ask you for, you'll need to have for when you apply for Predoctoral Award. And there are a number of uploads that you need to include, or downloadable templates that you can pull off the system, complete, and then upload into the system. So it's an opportunity to grab those forms. So you've got copies of them and you can start having a look at what it's asking for, what the format is, etc. So it's Senior Clinical and Practitioner Research Award, or SCPRA.
Senior clinician and what? Tell me that again.
Senior Clinical and
And
Practitioner Research Award. It is a mouthful. I apologise.
Oh, someone's got there quicker. Thank you. I'm writing it all out. There we go. Thank you. I can't see any other questions in the chat or any hands up, but if anyone has them, we're here for another few minutes. If anyone does have any other last minute questions. Otherwise, I was going to say I know there's been quite a lot of people asking about narrative CVs, which are relatively new for NIHR. And we have got a session on those on the 24th of November. Now, I think that session is actually already full, but just to say, we will put the recording of that session up on our intranet afterwards, so it will be available, and we'll circulate an email with links to that later, if that's of interest. And now 2 hands have gone up, so back to Faisa, and I'm sorry if I'm not saying that correctly, put me right.
No, that's okay. It's Faisa. I've put the question in the chat. But I was just a bit confused because I know you mentioned the academic and the local, well, practitioner one. I've seen on the website that I do need to find a host if I'm leaving my position as a social worker, but I'm also not an academic. So how would I then position an application if I sort of fit between both?
Do you mean you will no longer have a contract with your local authority? You're planning to take up an academic? Okay.
Yeah, I don't think they would want to support my application. So I'm looking for a university to host me instead as an employer. But then I wouldn't be a practitioner sort of thing.
But I think then you would be you would be applying, but you would be probably seen by a different panel. I think you wouldn't go through the local authority panel if you'd established a relationship with another with a university employer. I'm not sure whether anyone from the academy can be more clear.
I was going to say for this particular panel, we would expect it to be local authority based or in a service that's commissioned by the local government or local authority. We do have people that have partnerships with universities. In fact, you'd be expected to have one because you need to have your primary academic supervisor. If you want, Fraser, if you want to drop an email to someone up in chat, we can have a bit of a offline chat about that if you'd like. Because yeah, there might be one of the other committees might be better suited possibly, but we can have a chat about it.
Okay, thank you so much, Richard and Louise.
Thanks, thank you. And Rahman, did you want to come back in?
Yeah, sorry, and thanks for the opportunity you're given to me. I know there is the opportunity to do the master as well, same as you're doing. Just I want to know what's the difference between these two and how we can understand personally which one is more suitable for me. Because I have been advised I can, instead of doing that, why I don't go and do the master through the academic. So do you have any advice regarding that?
I would suggest actually reach out to one of us at the centre and see if you can talk to an advisor one-to-one about your options. Because what's going to be right in terms of what to apply for and where to go is a very individual thing. And it might be easier to actually talk it through, your context, your ideas, what you're thinking, what you're hoping for with an advisor, and then they can help point you down the right pathway for you. So I would say reach out to us, get in touch at that point.
Right, thank
Thanks,
you.
Laura.
Thank you.
And
Yeah.
And I guess just to be clear, you can use the funding in a pre-doctoral to do a full master's at UK rates, or to study some modules at master's level, not necessarily the full master's. And I think you talked about that, Laura, when you were talking about choosing what's right for you at your career stage and where you're at the moment. Okay, we are right on time. So sorry, someone. No. Okay, I was just about to bring us to a close, bang on time. So we've done well, and everyone can get off for some lunch if you haven't already. We'll circulate the slides and the recording after this through Alex Rogers on the call. Will do that for us. So thank you all very much for your attention. Thanks especially to Alex Ryan for sharing your experiences. That was really valuable. And thanks, Laura, and thanks to Richard from the Academy, and Scott for manning the chat for me. Thank you very much, everybody, and we'll be in touch soon. And best of luck with your applications, and do come and talk to us about them. Thank you.